All right, hello everyone. Thank you so much for joining us today. So we'll be giving a brief talk on sustainability in medicine and clinical care. Okay, to give a brief overview, we'll first start with an introduction of what we're talking about today and an introduction of our wonderful panelists. And then the School of Medicine. So me, Akanksha, and Melanie are all part of the Planetary Health Alliance Club. So we'll give a brief introduction to what we do at the School of Medicine and go over a needs assessment that we've done for the School of Medicine. Then we'll transition to Dr. Melissa Pavelack, talking about sustainability in medicine and clinical care. Then Dr. Cecilia Tamori will talk about integrating planetary health into curricula at Johns Hopkins School of Nursing. And then we'll wrap up with kind of a moderated discussion and opportunity for questions. So we mentioned that we have some wonderful guest speakers. So we have Dr. Pavelack, who is a pediatric critical care fellow in the Department of Anesthesiology, and Dr. Cecilia Tamori, who is an associate professor and director of global public health and community health in the Department of Nursing. So they will go over more what they will be talking about right after we do kind of a needs assessment of the medical school. So first, we'll just talk about Planetary Health Alliance, which is the club me, Akanksha, and Melanie are part of at the School of Medicine. So the club is part of Medical Students for a Sustainable Future, which is a network of medical students who recognize climate change as an urgent threat to health and social justice. This is a group of over 105 medical schools in over 36 states and countries. So what do we do specifically? We educate students about planetary health, which is defined as a solutions-oriented transdisciplinary field and social movement focused on analyzing and addressing the impacts of human disruptions to the Earth's natural systems on human health and other life. So within our club, we assess the sustainability of the School of Medicine. We educate students on planetary health and sustainable practice through a student-led course, and we advocate for sustainable policies on local and national levels. So with that, I will transition to Akanksha, who will go over our needs assessment of the medical school.
Yeah, so the needs assessment is basically a report card that is shared by all the medical schools in the country that participate in this. So the way that it works is we have a shared set of questions that every single medical school answers in their specific context. We have a total of 51 questions, which are worth 150 points. And these are each scored with a standardized rubric, and explanations are added to each of the questions to explain the individual circumstances of each medical school. Here's an example of what a question might look like, as well as the rubric, the way that it is answered, and an explanation. Questions are grouped into sections, and there are a total of 5 sections. These are the curriculum, research, community outreach, student-led initiatives, and campus sustainability sections. And the question scores within each section are added up, and a grade from A to F is assigned. Here is an example of how evaluations are made on a section level. Here we see the 5 different sections, the scores that our specific medical school got on those sections, and how they're graded on a letter grade, depending on the percentage that they received. We will go through each of these sections in a little bit more detail in just a few minutes. Finally, we create an overall 1-page summary that summarizes all of our findings from the entirety of the report card. Each section is weighed equally, and an average grade from A to F is assigned. This 1-page summary also includes some of the key findings within each section, as well as some of our recommendations for our medical school. Here's sort of a bird's eye view of what our 1-page summary looks like. We don't expect you to try to read this. We will try to go into detail in just a moment. So for our first section, which was the planetary health curriculum, some of our findings were that we had 1 elective student-led course on planetary health within the Johns Hopkins School of Medicine, and we also had individual lectures addressing climate change, which were within short elective courses. We, however, found that there was a little bit of a lack of integration within the core curriculum, given the elective nature of these courses. And we recommend that the medical school consider trying to include case studies regarding environmental health hazards, for example, within our organ systems block when we study different units. as well as teaching us clinical skills related to environmental health exposure history taking within some of our clinical courses. Overall, we assigned this section a grade of D+. Our second section was regarding interdisciplinary research. We found that there were various faculty members who conducted planetary health related research, and Johns Hopkins as a whole had dedicated departments and centers for this purpose. However, these were not present within the School of Medicine itself. There were also no recent research conferences hosted on this topic. We recommend that the School of Medicine consider partnering with existing centers to bring opportunities to medical students who may be interested in these topics. And we think that a central database within the School of Medicine, or perhaps within Johns Hopkins as a whole, could be helpful to connect students to faculty with their specific research interests. We assigned this section a grade of B. The last section that I will be talking about before handing off to Melanie is the community outreach section. We have multiple community partners at the School of Medicine who have an environmental focus, and these organizations have moderate student engagement. We found that there were accessible online resources available through JHM on environmental hazards for the community. However, we did not find any community-facing events or continuing medical education events for providers that addressed planetary health specifically. We recommend that JHU consider hosting community-facing events, especially given the prevalence of environmental health justice-related issues in Baltimore. We assigned this section a grade of C. Now I'll hand over to Melanie to discuss the rest of the report card.
Yeah, thank you, Akanksha. So our fourth section is support for student-led initiatives along the medical campus. So our findings show that the one club devoted to sustainability and healthcare is us, the Planetary Health Alliance, who receive funding through the school through the Medical Student Senate. And we also have a faculty member, Dr. Bass. However, these are requirements for all student organizations on our campus. Additionally, the school offers opportunities for students as a whole to participate in co-curricular planetary health programs, and these programs are offered such as community service learning projects through SOURCE, the community service office that is shared between the 3 graduate schools of nursing, public health, and medicine. There's also opportunities strictly through the School of Public Health and our topics in interdisciplinary medicine courses that we take throughout our curriculum. Recommendations are to offer increased support to students interested in sustainable initiatives, whether through additional programming or specific funding, and we give this section a grade of a B. The last section, section 5, is campus sustainability. And unfortunately, Johns Hopkins School of Medicine does not have readily available information regarding its own sustainability. However, we recently hired a sustainability manager who will be in charge of managing this. And hopefully one of our recommendations is that the sustainability information will be publicly available. Another finding is that our school has compost and recycling bins throughout the campus, environmentally sustainable lab initiatives such as green labs, and has done a partial divestment from fossil fuels. Our last recommendation is that the 2030 JHU sustainability plan should explicitly state a goal to reduce our carbon footprint with the institution as a whole and the medical school, and also take actions to tangibly work towards that goal. This section receives a grade of a D+. So that was our Planetary Health Report Card findings for the 22-23 school year. And now we are going to move the panel on to our wonderful guest speakers to speak about sustainability in medical curriculum and the healthcare sector. So our first speaker is Dr. Melissa Pavelack, and she is a pediatrician and pediatric critical care fellow at Johns Hopkins Children's Center. Dr. Pavelack has been involved in the Midwest Pediatric Environmental Health Specialty Unit and contributed to the Illinois Department of Public Health's investigations of manganese, acute lead, and mercury exposures. Through PEHSU, she completed the National Environmental Curriculum, created a pediatric environmental health curriculum, and taught medical students at Midwestern University Chicago College of Osteopathic Medicine. She also partnered with the CDC-funded Brace, Illinois project to educate health professionals
on climate change impacts and minimize health impact. Dr. Pavelack has received NIH T32 funding to study the impact of the environment on pediatric asthma emergency visits and admissions with a focus on changing weather patterns due to climate change. She continues to create climate change curriculum for health professionals and students, and is lastly involved in quality improvement projects with the pediatric ICU. So let's all give a hand to Melissa Pavelack. We're excited to hear what you have to say.
Okay, before we get started, I just want to do a couple quick polls of the room, and I'm not going to be able to poll people on Zoom, so just people in person. Who here actually works in healthcare and medicine? And keep your hand up if you work directly with patients. Okay, gives me a sense of who I'm talking to. So as they mentioned, I've been working on climate change curriculum for a long time, been about 6 years now. And so I'm not going to talk a lot about the curriculums, as we're going to focus a little bit more on what sustainability in medicine looks like. This was recently presented to me at the Society of Critical Care Medicine for our climate change talks, and I thought it was a really nice just depiction of what we have coming for us, right? We just faced a huge crisis with the pandemic, and we have climate change as kind of our next big battle. So let's see how we're going to prepare for it. I put up some of the organizations that have taught me what I learned, and I'm just going to talk a little bit about some of these just to add some context to where I got my experience. So my on the bottom left, we have the Pediatric Environmental Health Specialty Units. Who's heard of these before? Has anyone heard of them? So just briefly, there are 10 in the country. They're in every EPA region, and essentially they are funded to educate the community and providers on environmental exposures and climate change. And so they have been around for at least 20 years now. And they have an online free curriculum for providers, for also for the community to kind of learn about anything from heavy metals to climate change. And they also run a 24-hour hotline for like clinic visits and or questions. So for example, if you've mold in your house, if you were exposed to something on an industrial site, they answer all of those questions. So I almost think of them as like the occupational medicine center for children. Next up here, we have the Medical Society Consortium on Climate and Health. They lead an annual conference in our group of a lot of professional organizations, including the American Academy of Pediatrics, the American College of Obstetrics and Gynecology. And so they have at least 100 different professional organizations and are teaching not just those organizations, but the members about climate and health. It's also a wonderful conference because they go through individual hospitals' questions and projects. And so folks that are looking to network, it's a really good place for that. Healthcare without harm. Who's heard of that before? Okay, so about half the room have heard of healthcare without harm. They really got famous when they kind of took mercury out of healthcare. That's really how they started. They started in the United States, and they've kind of expanded to the whole world, trying to remove everything from thermometers to all the other sources of mercury that were directly harming our patients. They focus as an organization much more globally and have created a group called Practice Green Health, which you may be familiar with. It's kind of a branch off of Healthcare Without Harm, really focused on improving the sustainability of hospitals themselves. And we'll talk more about Practice Green Health, not just because Hopkins is a member, but because they have a lot of resources if you're looking to get involved in medicine sustainability, but not on how to do it. They have practice presentations, and they also run a conference. I have been a part of that group just through their physician advisory council for a while now, and it really is a place, again, for networking and meeting people in this field. Physicians for Social Responsibility is an organization, and Physicians for Social Responsibility is a nationwide organization that initially started working on nuclear, and they won the Nobel Peace Prize for reducing nuclear across the country and globally. And they have focused now on climate change, specifically in Chicago. That's what the group is working on now. The two last things I want to chat about are kind of this LEAD program I mentioned up here. I'm not going to talk a lot about that, but that is really where I learned everything I know about advocacy that wasn't taught through professional organizations. And so how to do policy briefs, how to meet with your state representatives. And that was a project where a state representative essentially gave us all a task for a possible bill that they wanted. And so we wrote a bill for nurse to patient ratios. And that experience has really informed my perspective on where I choose to spend my time within advocacy, which I much more do level at the state level versus federal level after that experience. And then the last thing on here is the Breathe Center. Who's heard of the Breathe Center here? So this is a center at Hopkins. It used to be a different funding structure like 15 years ago. And they changed their name to the Breathe Center most recently because we're much more focused on not just COPD, but on asthma and COPD and respiratory health in general. It is primarily a research group that is now working on translating their research to bedside and to the community. And so through the Breathe Center is where I do my research on asthma and weather. All right, so let's talk about medicine. If you are, I did not spend this talk going through kind of, why medicine is a top emitter. I think that at this point it is close to common knowledge that we are one of the top emitters, not just because of the amount of energy we use, but all the things we have to transport to our health systems. And so as you heard this morning, the transition to electric, not just at Hopkins, but across the country is happening rather quickly. This isn't just through where we source our energy, but also what we invest in. So you may have heard about divestment campaigns that are happening in schools of medicines across the country. And the goal is to kind of get, whatever money that we may have as individuals and as an organization away from fossil fuels and closer to the sustainable sources of energy. The other thing on here I put was energy use reduction, specifically to talk about how building structures are now having much more standards for how they are incorporating not just bringing light into the building to help with our perception of the day, but also how is that relationship creating lower needs for energy within the building. So LEED certification is kind of just an entry level. I'm not spending this talk going into building structures, but there is a lot more to kind of energy reduction than just LEED certified, but a lot more hospitals are using that certification. And then waste. We are huge wasters within healthcare. As you have probably seen, if you're in any hospital system, there's huge garbage cans in every room, more than you would use in a house in a single week. And a lot of that is to do with single-use packaging and everything coming wrapped in 2 or 3 things. And so you're seeing a move in a couple directions. One, you're seeing a move to using a lot more reusable equipment. It's quite interesting as the anesthesia and critical medicine department, we have a basically everyday email with supply updates. And so the entire department is very aware of like why we're not able to have our reusable scopes because of XYZ, and then it'll be back in 2 weeks. And so it's constant conversation because people are asking for those things. People do not want single-use things. And when we have to use them for temporary times, the department knows now that like we need to understand why. So I think that's a huge shift, right? When you see that the department is having to explain to you while single-use stuff is coming back into play for even just a couple of weeks, I think that's just a shift in mentality that's really nice to see. We also have on most of the units bio bins for unused equipment or opened equipment that wasn't used that can either go back to be re-sterilized and resold within the US, or sometimes they're re-sterilized and sold globally, kind of depending on the standards. I don't have this within my talk, but there is some studies, especially coming out of the West Coast, that are looking at the quality of things that are recycled. And you actually find that the quality of some of the things like laryngoscopes and different procedural things are higher in the recycled group. And the study wasn't designed to kind of look at why that is, but my theory is because they get checked so many more times that things that are broken, things that are not performing well get pulled out of that cycle because of the standard is actually higher for the recycled goods than the initial goods. So that's quite promising. Travel is another place that we waste a lot of energy, and Hopkins is one of the leaders in telemedicine. Now that doesn't go, yes, you can transition to telemedicine and reduce transport, but you're still using reliant on technology and energy to make that interaction. But overwhelmingly, that's less than the amount used with traveling. Food sourcing, Hopkins has at least, I'm aware of at least one farmers market that happens at the hospital on Thursdays. And they also are a CSA drop point, community sponsored agriculture. If you're unfamiliar, is essentially a program that you sign up for and you get kind of bins of food each week or each month. And so they have a drop off and pickup site at Hopkins. And then a couple other things. So drug take back programs, currently I'm only aware of once a year, we have a big kind of drug take back day, and they have drop boxes at other places. So these are unused drugs. And while most of the drugs in the environment actually come from people taking the medicine and peeing them out or, excreting them, and not usually from people emptying their drugs into the toilet, the drug take back programs are still effective in reducing the exposure in the environment. The last thing I put on here is kind of reconsider. And this kind of leads into what I was referring to about drugs in the environment. So we do not currently have a pharmaceutical rating system by environmental impact, although it's something that that Europe is working on, and that more and more doctors are calling for. And the idea there is to just educate physicians and providers on drugs that have comparable clinical profiles, which ones have worse environmental impacts. So I just put an example up here for anesthesia gases. Desflurane has much more greenhouse gas emissions associated with it than sevoflurane does. And so a lot of people have transitioned to using sevo when possible. This is also true, when talking about medications and how long they may be persisting in the environment. If it has a similar clinical profile, people are transitioning to things that won't impact the environment as much. And this also comes with cleaning methods in the hospitals. I feel like every 5 years or so, there's a new cleaning product that we have deemed, we cannot use this in healthcare anymore. And that's an increasing trend, is not just to value the immediate effect on patients, but also the long-term effect. As far as how medicine is preparing for not just climate change, but environmental disasters, one of the things you may have heard is flood-ready hospitals or disaster-ready hospitals. I think especially with the hurricanes in Florida this last year, there was a lot of news around how few hospitals are really flood-ready. And, there are many components to that. To say that probably about 1/3 of the hospitals in the US are flood ready. And things that you'll notice at Hopkins that we've done to become flood ready, most of our imaging is actually on the 4th floor at Hopkins Hospital. Very few things, very few of our imaging and things that we rely on are in the basement, which is kind of a trend from the past. And then we also have an increased frequency of disaster preparedness drills as well. And then the last thing, which I'm going to be a little bit brief on, is kind of equitable education and getting the information about the health effects of not just climate change, but environmental exposures. And so it's through the Planetary Health Alliance and medical schools. It is through Hopkins has a huge community that's doing education, not just for medical students, but for community members, for high school students, for middle school students. And some of those programs I'm involved in include the Lung Health Ambassadors Program, where we're teaching climate change health effects to middle schoolers and high schoolers. Also, you should time check me. I have not been keeping track of time at all. We're good? About 10 minutes? Okay, we're close to done. All right. And so I just put up a couple examples of within medicine, after medical school, if this is something that people are really interested in. There are residency programs for preventative medicine, and there is an occupational and environmental health residency program, but there's also fellowships. If you decide that your clinical world may be separate from what your research world is. And so for me, that is, very much the case. I practice critical care medicine, and all of my research is focused on environmental medicine. And so there are fellowships like pediatric environmental medicine and academic medicine fellowships that you can really take your research in that direction, if it's not necessarily what you wanted clinically. And then last is kind of the how. How do we get this done? And so a lot of the organizations that I talked about in the beginning are places that if you are in medicine, you can go to learn about how to get involved. But some of the low-hanging fruit are really green teams within the hospital. Hopkins has a green team that meets monthly, and you can go as like, I know nothing, and I just want to take a tour and understand the sustainability of Hopkins Hospital and maybe get involved. A lot of green teams have book clubs, journal clubs, things like that to learn. If you work through Practice Green Health, they teach you how to approach leadership. There is plenty of evidence as to why we need to start changing our health systems. And so they really have bundled that together for you to help you approach your leadership in making these changes and investments in sustainability. Most health systems at this point have an actual sustainability position within their hospitals. That's been a transition over the last 5 to 10 years. They typically exist within the supply department somewhere or another, just because a lot of this is about choices in what we choose to purchase. And the last thing I just wanted to mention is that there are environmental excellence awards that Practice Green Health gives out, and there's a couple other hospital rating systems about the greenest hospitals, and things like that really motivate health systems to transition their work. So I kept this talk rather broad because it's a huge topic, and we have a diverse crowd. So hoping in the discussion we can kind of pick what niches that people want to talk more about. And that's all I got for you.
Thank you, Dr. Pavelack, for that wonderful kind of overview of sustainability in healthcare. So without further ado, we'll transition to Dr. Cecilia Tamori. She is an associate professor and director of global health and community health at the Johns Hopkins School of Nursing, with a joint appointment at the Johns Hopkins Bloomberg School of Public Health. She's an anthropologist and public health scholar whose work investigates the structural and socio-cultural drivers that shape health, illness, and health inequities. Dr. Tamori is an internationally recognized expert on breastfeeding, infant sleep, and maternal child health. As part of her role with Johns Hopkins School of Nursing, Dr. Tamori is spearheading efforts to enhance the integration of climate change and planetary health into the nursing curriculum. So thank you, Dr. Tamori.
So I'm here really today to talk about some of the ways that we can transform the curricula. And I think that the lessons apply across really the healthcare profession. So we have some specific initiatives within nursing, but I'm hoping that everyone, whatever school you might be affiliated with, can learn some of the lessons that we have been learning, and there's much work to be done. So the role that I situate this within is a particular curricular initiative that we started under the previous dean of the nursing school, Dean Davidson, and Vice Dean Nolan, and our leadership has transitioned since to Dean Zanton, who has also incorporated some of the work into the current efforts and our strategic goals for the next few years. We were charged, me and my colleagues were charged with reviewing all content, curricular content across all of the programs that we have in community health, public health, global health policy, and advocacy. And one of the recommendations that we proposed based on that work was to focus on enhancing planetary health, because that was actually one of the gaps that we identified, which aligns with some of the report card findings that you also had. This is not a surprise. This is a national issue. So in healthcare, which is also siloed within different communities of healthcare professionals, this has not been a topic that has been, particularly prominent in the curricula. And so this finding was not a surprise to us. But planetary health is actually at the intersection of a number of strategic initiative priorities: global health, public health, community health, policy, and advocacy. And we also have this larger set of recommendations that I'm not going to unpack for you today, but one of the major ones was to align all of these priorities around health equity, health justice. And so with that in the center, planetary health is obviously a perfect fit across all of these different areas. This also makes it a little bit of a challenge because it is at the intersection of so many different things. So how do we implement some of these changes? Well, one of the ways that we have done that is by joining the Nurses Climate Challenge. And you probably are recognizing some of the same organizations that I will be highlighting because they are cross-cutting. In 2021, we joined the Nurses Climate Challenge initiative, which is a partnership between the Healthcare Without Harm organization and the Alliance of Nurses for Healthy Environments, which consists of wonderful group of advocates and leaders who have been doing this work for a very long time, and younger people who have joined this effort. So there's people who have been doing this work for decades, and I just want to highlight that we're building on all of that work and really standing on their shoulders. Every year, we track activities across all the schools that are participating in this initiative, and there's a live tracker that you can actually tap into when you go on their website, and I encourage you to do that. There's a website for Europe, and there's also one for the US. There are a lot of opportunities for implementation, and I wanted to highlight some of the resources that they offer, because many of these things are actually free to use and are relevant to everybody right here, because our work is cross-cutting. So there is a free textbook that's available for use. Everybody loves a free textbook, and we all know that textbooks in healthcare professions can be really costly, and that can be a barrier in and of itself for many students. So I wanted to highlight that there's modules, there's advocacy tools, and there are links to events and to various places of enhancing that curricular content, and there will be more of this coming. So I just wanted to put that up as a placeholder for people to use. We also have been highlighting some of the work at our school. And so we talked about, kind of cross-school initiatives and announcements about ways in which nurses can advocate for this work and draw attention to climate content. And so we had magazine pieces, and then Annie's also launched a podcast series. So the same resource that we just highlighted in the previous one, you can go and actually listen to all the podcasts. They're also really great use for teaching, to get to know other people who are also in the same community. And I'm also featured on one of the podcasts. And one of the ways that I try to make this argument is that whatever the area of interest that you have is dovetails with what you just said, that it doesn't matter what your interest might be, there is a link. And if you are not sure how to make that link in your teaching or your communication, reach out to colleagues who will help you make that link, because I am sure that we can find it. For me, my entry point was coming in from maternal infant health, and particularly commercial influence over maternal child health, particularly in breastfeeding and lactation. And that's actually some of the work that I've incorporated into my own course. So one of the examples that I wanted to highlight is some of the work that I've done in redeveloping a course in advanced nursing health policy, which I lead and have taught a number of times. And because of that gap that we identified in planetary health content, when we revised that course, I made sure that we have a lot more of it. And so as we develop the policy landscape and we make connections from local to global and back and forth, I wanted to make sure that I highlight this at every opportunity. So one of the things that I did was incorporate some of those resources from the Nurses Climate Challenge and highlight the IPCC reports as they were rolling out in whichever term I was teaching the course. And this one, obviously, the one from about 10 days ago that was released. And we also have weekly policy updates that I send out to students where I highlight various areas of content, and I try to make sure that this is an area that's always highlighted so that there's always a linkage. I also put in some work that I have sort of pursued in relation to some of the commercial influence in policy. So particularly to help equip our students in understanding that the framework that they're dealing with is not just about understanding the impacts, right? That's step one. But when you are trying to make a difference in policy, you need to understand what other influences might be at play. In this case, there has been decades-long disinformation campaigns that we are dealing with. And so I am highlighting some of that work, particularly in the cover-up of scientific knowledge about climate change and the ways that that was suppressed. And I hope that you're all familiar with this, but if you're not, you should be looking at some of the papers that came out from this. The most recent of them is about Exxon's global warming projections that show that Exxon not only knew what was happening, but actually funded science that was quite strong in modeling climate change and actively suppressed that science, covered it up, and instead created a denial campaign. And this is the reason why we are where we are 40 years later, because those models were built literally over 40 years ago. So I think that kind of attention is really, really useful when you are advocating in this space. Now, some of the other work that I have done is to create assignments that are dovetailing with some of this work and allow people to explore their interests and take it to the advocacy space within healthcare professions. So one of the assignments that we have is a health policy dialogue in which students create their own evidence-based policy message. And that can be done in any format really that they would like to deliver it. It has to be evidence-based. It has to communicate with other people in some way. So people have written, for example, letters to representatives, they have done mini policy briefs, they have done videos and social media outreach, and we have a growing number of nurse climate champions, which is very exciting for me. And before the demise of the Twitter sphere, I just pulled up some examples from last year's work where our students did a number of different things, from threads to videos where they talk about their own particular interests and their own clinical work and how they connect that to climate. And they are really pretty fabulous. I don't have time to show them to you, but I'm just drawing attention to them, and I love my students. So I'm really celebrating what they have been able to do. They're just fantastic. And I want to close with this framework, which is the commercial determinants of health, that allows us to engage with the ways in which industry has been influencing some of these key areas, which is what we're talking about in this symposium. The World Health Organization now has a centralized page for this. And last week, they released the Lancet series on commercial determinants of health. And this is really a framework that I think we can all make use of to understand how industry influences the entire set of processes, including the research, the science, the media discourses, and the policy landscapes in which we operate. And the recommendations that I think are aligned with all of the work that we're doing here is to help rebalance power between public interests and corporate interests to enable us to actually save our planet, which is our only home. And that's it. Thank you.
Great. Thank you so much to our guest speakers. And now we are going to start us off with the Q&A panel. So first of all, let me just move the camera to get it on our speakers. And the first question we wanted to ask was if you have any examples of other institutions or medical campuses that have effectively incorporated planetary health into their work or their curriculum.
Sure. I think it's happening quickly, like you mentioned, and so the Planetary Health Report Card is probably the most up to date, to be honest with you, that because you have students who are active in classes. I know that UCSF was one of the leaders in this field, not just because some of they had electives that you could take that were just a complete semester on climate and health or planetary health, but have incorporated some of it into their requirements. I know that places, Harvard is working on incorporating it. Again, it's all elective work that they're doing right now. And I'm personally only familiar with UCSF that has as a requirement in some of their core work. But it's probably more than that at this point. Where Midwestern, where I would build the curriculum, it's part of their pediatric core requirements. It's a 5-hour lecture that they get. But I would imagine that at this point, with kind of the push and everything, there are definitely more schools that are doing it.
I think success, we have to contextualize what that means. So I think more and more schools have some content. Much of it is still in electives, which is problematic. And it's not thoroughly integrated. So it is not considered as sort of core knowledge. And what I think is missing, and where the work I think is happening across the country, and if you tap into some of these organizations, you'll see where different organizations are leading on this, is that integration, that threading, and making sure that we actually are putting together the influences. So, you know, if we're talking about an emergency, whether it could be, you know, infant feeding, all those things have an effect, a very direct and very immediate effect when climate change accelerates disasters, right? That kind of integration has been limited. It's happening particularly, I think, in specific areas of the curriculum. So I have seen an uptick, actually apparently driven by Hopkins medical faculty on the anesthetic use. So I've actually seen that within the last few years. So when different people are drawing attention to topics, it comes in, but it is not something that is systematically done. I know, you know, Harvard is working on it, but there's a long way to go. So basically my take is that different schools are doing different things, but what we really need is a systemic transformation in which this takes centerpiece, you know, and we got a long way to go.
And one of the things that, just to speak to that point, is we are currently writing board questions that incorporate environmental medicine. And I think when I was initially pitching climate curriculum, you know, 5 years ago at Midwestern, it was really the board specs that kind of that opened the door to that. There was a surprising number of board specs that I could incorporate into the curriculum, whether it's, you know, lead poisoning and how climate changes could, you know, increase exposure, and just like making the ties between some of those things. But there's now going to be questions directly on health. And so those pediatric environmental health specialty units that I talked about are the group that's writing the board specs too, and that's really going to push it, right? Because once it's on the boards, you have to teach it somewhere or another.
Great, thank you. Yes, definitely a systemic issue, which requires complete integration into curriculums and practice as well. And then in the interest of time, do we have any questions from our audience that they would like to ask the panelists, or anyone who is on Zoom? I'm also monitoring the chat. If anyone wants to type in a question or unmute themselves as well.
And that first question is comment, dialogue.
Yes.
I think that, you know, I'd love to know what people were hoping to get from the session and kind of how it feels, and what your questions within medicine are too.
I'm Mariah Merritt from the School of Public Health and the Herman Institute of Bioethics, and really excited to hear about what everyone's doing. My question is about the National Academy of Medicine Action Collaborative on decarbonizing health systems. I just learned about it about a year and a half ago, but they have a set of network organizations, and anybody can apply to be a network organization. So perhaps this is a subject for dialogue offline, but it would be great if Johns Hopkins, if it hasn't already done it, could become a network organization in that group.
Can you tell us more about it? I'm not familiar. Are you familiar with
I
it?
think I've heard of it, but I don't think that we are members. I'm not sure.
I doubt it.
Who is leading that, or who should be leading that, but it sounds like it's an opportunity that we should be taking out.
Yeah, yes, my understanding of it is the National Academy of Medicine has convened, you know, a lot of hospital systems across the country to get going on decarbonizing health systems, because we don't particularly have a national health system.
Right.
Unless you can, the VA is like a partially national health system, but you know, we have like what 6,000 different hospitals, and they all have to be part of a systematic approach. So I think that's what the National Academy is trying to do, and they have divided their leadership groups into supply chain, financing and metrics, healthcare delivery, and education. So it sounds like we have a very strong base, at least, and if not in other areas, to engage with them on education.
Yeah. Thank you for pointing that out.
Yeah, we'll follow up, I hope.
It's all of the above. I mean, there's the other pieces that, you know, all of this is happening, has to happen at the same time.
Mhm.
So, you know, there's the decarbonization and the actual transformation of health systems and healthcare systems. The teaching also has to change, and all of that has to then lead to practice changes. So it's like a hospital system, but also the roles that healthcare providers play in the community,
Mhm.
that I think is a piece that has been not looked at adequately. So a lot of the sort of initiatives tend to focus on hospitals, which I think is really important and really central. However, care takes place in communities, and communities are the people who are disproportionately affected, are always the most marginalized. So, you know, that disproportionate impact piece needs to come back in to help professionals actually
learning from community members and then taking that into, both their practice work and their clinical practice, but also I think there's not enough of the advocacy policy change part. I mean, healthcare providers are extremely numerous, tens of thousands of people who could be tapped to lead some of this work and work together. For that to happen, they have to be trained. So they have to understand why this is important in the first place. So the curricular piece, it has to be integrated in the health system, in their practice environments, and they also have to participate in the policy realm. And we don't do particularly well on that either in medicine or nursing. We do better in public health, but we're siloed across those different domains. So I think that piece really needs to be built somewhere. Thank you.
Hi, I'm Jenny. This was a really great presentation. Thank you. On the Land Action Collaborative piece, I wanted to mention Admiral Rachel Levine, he's the Secretary for Health. He is one of the co-chairs, and so the government itself is actually actively involved in the Land Action Collaborative as well as my office. So that's exciting, and it'd be great, I think, if Hopkins joined. I also wanted to ask about the commercial premiums of health. I haven't heard that term before, and it seems like a really cool paradigm. I was just curious, there are so many private sector organizations that have a lot of money that are now making commitments to decarbonize. Do you think that then the commercial sector can kind of push medicine towards decarbonization, or do you think it's more greenwashing maybe and not going to actually activate that change?
I think you have to be really careful in examining statements and actual action. One of the biggest things that I learned from that literature is that the claims do not align with reality at all. They're marketing. So they're actually part of the marketing arms. And if you are familiar with any other corporations that have driven, the crisis that we're in, Exxon being one of them, but only one of them, plenty more to go around, there's other papers and archives. That they actually develop some of the language that we use, like carbon footprint and other kinds of things. Anything that shifts the rhetoric to these, claims and also individual responsibility, the favorite diversionary tactic, does not mean that they're actually not pursuing the same things at the same time, including continuing to pursue fossil fuel extraction and use. So a podcast that I recommend for everybody is Drill. If you want to get into this, they have all the details and they have been running a series for years, really, really helpful. And of course, commercial returns have followed. But I think that area of work, we really need to get much more trained in this to be able to work in any of these spaces, because we can easily be caught by efforts that sound really good on paper, and it turns out that they're actually not so great.
Great, thank you. And with that, it is 10:50. I would like to say a huge thank you to our panelists, Dr. Tamori and Dr. Pavelack. Your talks have been so enlightening and informative regarding how the environment has impacted healthcare in a number of seemingly unexpected ways, but have also been very optimistic in terms of what our fields can do to help the cause. So thank you so much. And thank you to all of our.
So I'm going to steal the podium for a minute. I've noticed over the years that there's a lot of cycles of up and down in the organization of medical students, medical faculty, nursing students, nursing faculty. Like there'll be a couple of years when the medical students are very organized and doing a lot, and then it kind of falls apart. And fortunately or unfortunately, people graduate and then they get a job. And I like it that people graduate and get jobs, but then the whole system keeps falling apart. And I'm going to put a question to you, which we don't have time to answer, but could the SLC play a role in helping to sustain the efforts over time? Because I know, like, say you're a medical student, you graduate, you have residencies in some other part of the country, you can't keep sort of nurturing what's happening here because you're on call all night or something, right? So so I'm putting the question out there, but I'd like you to talk among yourselves, like how can we help to sustain the people interested in sustainability? And I'd also like to mention, and maybe Julian could say more, that the health system is a separate organization from the university, and the health system is going to be doing its own sustainability plan, I believe, right?
So hi everyone, I'm Julian Gresco. I'm the Sustainability Director for the University of the Office of Sustainability. We've been working, I think some of you might be aware that the health system and medicine facilities teams merged a few years ago. And so as we've been collaborating in the development of a new plan for Johns Hopkins University, we are having conversations with people who wear hats, both on the health system and medicine side, and a lot needs to blur very quickly. And so as we've been developing that plan for 2030 and beyond, we're working directly with people involved in the stewardship side, managing our facilities on the health system. I shared this week actually that I saw, this is just tangential, but I saw UC Irvine just announced one of the first fully electrified central plants for an academic medical center in the world. I saw that there is a new waiver now allowing hospitals to use microgrids to power those, to power their facilities. There's a lot of tensions around the need for firm and reliable power for patient care. And so I think there's a ton of work to do. But we're starting to get the right people in the room that appears righteous about the need for sustained actions. Thanks, everyone.
Well, I think we're done. Thank you. This was a great.